you're trying to get pregnant, then you need to know these top tips to help you get pregnant fast. Stick with me to the end on this because I'm going to share when you should start seeking help at your doctor's office and the labs that you should be starting with. The absolute first thing that you must do is you need to know your specific menstrual cycle. You need to know what's happening at each phase of your cycle and when and if you are ovulating. Now, the worst way to do this is to use one of those general apps that you can find on your phone where you put in your period start date and it kind of spits out this algorithmic guess as to when you're ovulating, and it tells you these are your fertile days and this is when you ovulate and this is when you're going to start your next period. These are all guesses. So that's the absolute worst way to know about your menstrual cycle, is to be using one of those apps that just guesses. The other really bad way of tracking your menstrual cycle is to only be using ovulation predictor kits. Now, ovulation predictor kits are great. They're a great tool, but they cannot tell you if or when you are actually ovulating. It only gives you an idea of when there is the LH surge, which usually happens a few days before you ovulate. What OPKs are great for is letting you know that your body is preparing to ovulate, but it cannot confirm. So the best way for you to learn about your personal menstrual cycle is to use basal body temperature charting along with OPKs. That way you have an idea of when your fertility window is opening and when you're getting that LH surge, but you also have confirmation of exactly when you're ovulating. Basal body temperature charting also gives you a really good idea of what's going on with other hormones in the meantime. We can gather a lot of information about your thyroid health, your cortisol levels, your adrenal health, and a lot of other things as we're tracking your cycle that way. But this is critical stuff to know. You have to know about your personal menstrual cycle. I can't tell you how many of my patients have come into me and said, I've been trying for over a year and I don't know what's going on. I haven't been able to get pregnant. My doctor says everything is normal. And then I ask them, how are you tracking your cycle? It turns out they're using the app, and the app is telling them to have intercourse on completely different days than when they're actually ovulating. So the app is telling them, hey, have intercourse around day 13, 14, 15, but they're not actually ovulating until day 19, 20, or 21. And that timing of ovulation can perfectly fall within normal limits depending on your cycle. You have to know, when do you ovulate? Are you ovulating? Let me know down in the comments if you are somebody who uses one of those apps on your phone or you're only using OPKs. And if you feel a little confused about your cycle, you feel kind of like, I don't really have a handle on it, it might be time for us to talk about you picking up and doing basal body temperature charting along with your OPKs. Once you start getting a really good handle on your personal menstrual cycle, now is time for step 2, which is to really assess your health and your menstrual cycle for any problems. This part is extremely important and gets skipped most of the time by most people because, when you're trying to get pregnant, you just want to get pregnant right now. You want to be pregnant yesterday. You may have waited a really long time. If you met your partner a little later in your life, whatever the reason may be, you want to be pregnant yesterday. So this is the step that gets missed the most often, but this is the step that is actually one of the most important. And that's because if we have health problems and we have menstrual cycle issues and we kind of just roll right over and try and push our bodies to get pregnant, you could set yourself up for actually having miscarriages later on. And this is what I did. I had a lot of cycle issues and some health issues that I kind of just got used to. They were normal for me and I really kind of ignored it, and I was able to hack my body into getting pregnant. I wasn't able to stay pregnant. I don't want that to happen to you. So now is the time to really take a look. Do I have any health issues that are going on? Have I had a lot of gut problems for the past couple of years that I'm just ignoring? Am I unable to sleep? What's going on with my cycle? This is where basal body temperature charting is absolutely key. You have 4 main phases of your menstrual cycle. You have the period phase, the follicular phase, your ovulation phase, and your luteal phase. Now, the 2 main phases are obviously your follicular phase, which goes from day 1 of your period to the day of ovulation. And then you have your luteal phase, which goes from the day after ovulation to the day of your period. Now, when you do basal body temperature charting, we're able to really gain a lot of information. Are you ovulating early? Are you ovulating late? Is it very irregular? Do you have a short luteal phase that can get in the way of implantation? I've had lots of patients who have been trying for over a year only to come and find out they have a 7-day luteal phase and they ovulate way later than they thought they did in their cycle. Once we start figuring out, well, why is their luteal phase so short? That's when the magic happens, and that's when they're able to get and stay pregnant. Some health issues that you should definitely take note of if you're having are things like having trouble sleeping, eczema, psoriasis, having a lot of gut problems like constipation, diarrhea, gas, bloating, cramping, heartburn. These are all signs that there's imbalance in your body. Other things that are really important to take note of are fatigue, brain fog, joint pain, even depression and anxiety. These are all signs of imbalance in the body and that you're not optimally optimally healthy. Now, for a lot of women, these can mean that there's a lot of other deeper issues happening, and we want to make sure we're taking aim at the root causes of those things. You need to be optimally healthy to make sure that we can get and stay pregnant. We don't want to set ourselves up having trouble getting pregnant or having trouble with miscarriages later on. Some cycle issues that you definitely want to make sure that we're taking care of would be things like irregular cycles. Now, if you're having your period every 28, 29, or 30 days, that's not irregular. We're talking about a period that's coming every 30 days, then every 52 days, or every couple of months, or you're only having 7 periods a year. This is something that's a big alarm bell for us. There's a lot of imbalance in the body. And if your body is already saying like, oh, we can't really give you a regular period, it's communicating to you it's not ready to get pregnant. So we need to figure out, well, what's going on there. Some other menstrual cycle problems that you need to be aware of would be things like decreased or no cervical mucus. That can be a sign of an underlying yeast infection or some other issues in the body. A short luteal phase. This can get in the way of implantation, but it also means that your body is struggling to have a good hormone balance, and it can be indicative of low progesterone, which is definitely related to egg quality. Another thing is irregular ovulation or no ovulation. Are you ovulating really early, like day 5, 6, or are you ovulating really late, like day 30? Again, these things are not normal. So if your body is doing something like this, it's not random. It's doing it for a reason. So it's our job to really figure out, well, what is causing that cycle irregularity? And then we need to fix it. If you're trying to get pregnant on top of a cycle irregularity like this, it could be setting the tone for you not being able to get pregnant at all, or for you being able to get pregnant but not stay pregnant. This is something we definitely don't want to set the stage for. So we want to make sure we're assessing your health, we're assessing your menstrual cycle. We want to make sure we take the time, make sure you're optimally healthy and your menstrual cycle looks good, because this will set the stage for a healthy pregnancy and a safe delivery. The third tip to help you get pregnant faster is to make sure you have a good, nutrient-dense, whole foods based diet. You really want to make sure that about 80% of the food that you're eating on a daily basis is from whole and unprocessed food sources. Everyone's diet will look a little bit different, and that's totally okay. Your body is going to be different than anybody else's body, so there's no one size fits all dietary recommendation here. But you do need to make sure that you're having enough protein and enough fat. These are 2 huge fertility superfoods, and a lot of times they get left out in the dust. One thing I find very commonly is that my women are not eating enough protein. You need to make sure you're eating optimally 1.5 grams to 2.2 grams of protein per kilogram of body weight per day. That can seem like a lot to you, and if you do the calculation, you might find, oh my gosh, I'm only eating 40 grams of protein a day and I'm supposed to be eating 100. If that's the case for you, you need to make sure you work on bringing that protein up, because it is an absolutely important fertility superfood and it will help with your hormone levels. I have lots of videos all about food, the best food, the foods to avoid, and things like that, so make sure you check those videos out. The fourth thing that you really want to make sure you're doing is that you have a good supplement foundation. This is extremely important because the very early and critical developmental stages of a pregnancy happen before you even know that you're pregnant. That's why it's important that you're on these 5 foundational supplements at least 3 months before getting pregnant, and then we're going to add and adjust depending on what's happening in your body and what's happening in your cycle. The 5 that you need to be on are a prenatal with at least 800 micrograms of L-methylfolate. And there's a lot of controversy about folic acid versus folate, but I've done a whole video on that, so please check that out and make sure you're taking the correct form of folate. This is extremely important. The second thing you really want to make sure you're taking is a D3 and K2 combination supplement. This will be based off of your personal vitamin D numbers, but you want to make sure that your vitamin D level is between 60 and 80 nanograms per milliliter, which is equivalent to about 150 to 180 nanomoles per liter. The third supplement is magnesium glycinate. I recommend usually a base minimum of about 300 to 500, and sometimes even more than that, depending on what's happening for you. Maybe you have a lot of stress, maybe you have a lot of anxiety. If you have trouble sleeping, we may need to add more or less depending on what's happening for you. The fourth thing is a probiotic. Normally, I'll recommend a lactobacillus bifidobacterium blend at differing doses, depending again what's happening for you. But there are other forms and other strains of probiotics that I will definitely use depending on the symptoms you're having and your medical history. And the fifth foundational supplement is a fish oil supplement. I usually like a cod liver oil based supplement for this. And you're also going to want to make sure you're eating seafood 2 to 3 times a week as well. Studies do show that couples who eat seafood regularly throughout the week conceive faster than couples that don't. If you tolerate seafood, that's great. You still want to make sure you're having the fish oil supplement with that. If you're not someone who can tolerate any fish at all, including a cod liver oil supplement, then you want to make sure you're getting a DHA EPA supplement that's algae based. And again, one once these 5 foundational supplements are in place, we want to make sure we're assessing your menstrual cycle, your health. We may need to add some things on top of that at differing doses to help regulate your cycle or get some other blood parameters back into alignment. Now that we've done all of these other 4 steps, we're looking at our cycle, we've assessed our health, we've assessed if there's anything that we need to make better in our cycle, we have a good diet, we have our supplements in place. Now it's time for number 5, which is making sure that you're timing intercourse correctly. The correct timing for intercourse is going to be in the days leading up to and on the day of ovulation itself. The normal progression of your menstrual cycle should be that you have your period, your bleeding days, then we have some dry days where we're not bleeding and we're not spotting and we're not having any cervical mucus. And then you will start to notice that your cervical mucus is starting to change. As that's happening, that's a sign for us that the estrogen is rising and the fertility window is opening. That means we're getting closer and closer to ovulation. Your body is preparing to drop that egg. Your goal is to have sperm waiting where they're supposed to be when that egg drops. Sperm can live inside your body for about 5 days. I have seen it live inside a woman's body for up to 7 days. I had one woman who had intercourse one time 7 days before she ovulated, and that was the only time she had intercourse and she was able to get pregnant. So that does happen. In order for that to happen though, we do need to make sure we are having good quality cervical mucus for at least that 3 to 5 days. So your intercourse timing is going to occur during the time that your cervical mucus is starting to change into that fertile mucus. As far as frequency goes, I usually recommend to have intercourse about every other day in that fertile window up to the day after ovulation is confirmed. Frequency can be a little bit different and it will depend on the man's sperm count and a bunch of other things. If your partner has a low sperm count, however, you may want to go every 3rd day. So intercourse, 2 days of a break, and then intercourse again. Many couples that I see who have been having intercourse every single day, what they will do is they will actually run out of sperm. You might be thinking, shouldn't I be having sex every single day in my fertile window? You can absolutely try that. But if you're going a few months having intercourse every single day in your fertile window, you may want to try pulling back and going to intercourse every other day. Sometimes couples who are having intercourse every single day during their fertile window, they can actually start to deplete the amount of sperm, and that actually can work against you. The next tip to help you get pregnant faster is to make sure that you're managing your stress and your sleep. Now, of course, we can never avoid stress completely. It's just not possible to do, but there are a lot of things that we can do to help manage stress. And I have a couple of videos on the channel, so you make sure to check those out. The other thing is to make sure you're looking at your sleep. Sleep is incredibly important at looking at your overall health. And if you're having trouble sleeping or you've always had an insomnia problem, this can actually be an indicator of poor gut health as well as some other imbalances in the system. So while you might have tried a lot of different tactics to try and reset your circadian rhythm, they might not be working because we're not focusing on the root cause problem, which could actually be inside your gut. So if you're somebody who has struggled with sleep a lot over the years, either you have trouble getting to sleep or you have trouble staying asleep, this is something we kind of need to dig a little deeper on. And the last tip we're going to talk about today is knowing when to get help. Now, the recommendation for this will vary depending on your age and your history, but if you are 30 years or younger and you do not have an irregular period and you know you are timing intercourse at the right time, then I do recommend going in to get a checkup at 6 months. I know a lot of places and a lot of doctor's offices will tell you, hey, you have to try for a full 12 months, and in some countries that is the case before you can even get an appointment. But if you are able to get an appointment around that 6-month mark, I absolutely recommend going in to get things checked out. If you are in a place where you can't get an appointment until you've hit that 12-month mark, then I recommend we go back into step 2. Then that's the time where we really have to look at your full body. What's going on with your health? What's going on with your cycle? If you're not basal body temperature charting already, that's something you should absolutely start doing, so we can really get into the nitty-gritty of what are some things that we can optimize while we're waiting for that 12-month appointment. Around 65 to 80% of healthy couples trying to conceive will conceive within that 6-month mark, while about 85 to 90% will have conceived by that 12-month mark. So if you haven't conceived by the 6-month mark, then I definitely recommend going in to see someone. Now, if you are age 35 and above, I recommend we see someone before we even start trying to conceive, especially if you're starting off with an irregular cycle. If you're someone who has been on birth control for a really long time and you're not really sure how your cycles are going, then I recommend getting off the birth control and giving yourself around 6 to 8 months of regulating your cycle and getting your body into a better place. But for age 35 and above, I definitely recommend let's see your doctor before we start trying. Let's get some labs drawn, and we definitely have to do that full assessment of what's going on in your health and in your menstrual cycle. Around age 35, definitely around 39, 40, that's when we have to really start being worried about egg quality. And if you want to have multiple children, it's the time where we have to think about fertility preservation over the long term so we can have as many kids as you're wanting to have. In terms of what we want to assess when we do get to the doctor's office, I definitely recommend that we get a pretty pretty detailed lab report, and this includes a full thyroid panel, which gets missed a lot of the time. A lot of doctors' offices will just run the TSH, or they'll run the TSH and the free T4, but then we're missing the free T3 and the thyroid antibodies, which more often than not can show us a lot of what's happening in the background. So I definitely recommend getting the labs checked. Other things that would be good would be getting an ultrasound. Sometimes they'll do an antral follicle count depending on your age, and sometimes they'll even want to do an HSG, which is to check for the tube patency. This will all depend on your personal doctor and practitioner, but this is just to give you an idea of some of the things to expect and some of the things you might want to ask for. Hope that video was helpful, ladies. Let me know any questions you have down in the comments, and I will see you on the next one. Bye.